Hello! On today's episode, we're going to talk about vitamin D. I'm sure most of you have heard of this vitamin, maybe even taking it, but I guarantee you will learn some new facts today that you didn't know. So let's dive in. It has long been understood that having low levels of vitamin D are tied to an increased risk in developing an autoimmune disease. Recent studies have even uncovered that different people have different vitamin D responsiveness, which means that if multiple people were to take the same amount of vitamin D, that they would not necessarily have the same levels of vitamin D in their blood. The question is, why? Studies have actually found that approximately 25% of the population does not respond to conventional vitamin D dosing. 25%! That's 1 in 4, which means the daily recommended dose of vitamin D, which is about 1,000 IU or 1 drop of the oil, is not enough for 1 out of every 4 people. There was also a study done over a 5-year course where they took some people and gave them 2,000 IUs of vitamin D a day and matched them with other people who were not taking vitamin D on their BMI, their lifestyle, and various other factors. And they found that in the group that took the daily vitamin D, there was a 22% less incidence of autoimmune disease. So just taking 2,000 IU a day decreased people's chance of developing an autoimmune disease by 22%. It's pretty significant. So we know vitamin D is important, especially if you have an autoimmune disease or if you don't want to develop an autoimmune disease. Let's talk a little bit now about why. What does vitamin D do for us? Vitamin D helps with so many different functions in our body. It helps with our bone density. So often people will take vitamin D with calcium. It helps to prevent breakdown of bone. It's also linked to mood regulation. So people with low vitamin D had an increased risk of depression and even suicide. It also helps to reduce anxiety. Having proper amounts of vitamin D in our body reduce our risk of cancer. It improves our quality of our sleep. And of course, most importantly for us, it helps to regulate our immune system. What does that mean? It helps with the T cells. The T cells are cells in our immune system that decide to ramp up our immune system or the inflammation or to dampen that response. And if we have an autoimmune disease, that means our immune system has not been doing that signaling the way that we would want. There's way too much inflammation. And so taking the vitamin D will help to balance that, which means turning down that inflammation, at least sometimes, so we're not dealing with that chronic inflammation that is associated with having an autoimmune disease. Low vitamin D levels are sometimes hard to pinpoint or diagnose because, of course, many of the symptoms of low vitamin D are also symptoms of a bunch of other things. So I'll go through the list with you of symptoms of low vitamin D, but ultimately, if you're experiencing these, it's always best to get some blood work done. Ask your doctor to check all of your vitamins and minerals and see if there is lacking, as a lot of these symptoms can overlap for many of those vitamins and supplements. So some of the symptoms of low vitamin D are fatigue, brittle bones, as I said before, depression, muscle weakness, bone or joint pain, gum disease, digestive issues, even asthma could be from low vitamin D, and of course, a suppressed immune system. So we know vitamin D is critically important for people with autoimmune diseases. and we know what the side effects are and the benefits are. So the last question is, how do we boost our levels of vitamin D? There are several ways we can do it naturally through lifestyle, one of which is getting out in the sun 20 to 60 minutes every day. And that, of course, is without sunscreen. Now, I know that in some areas where the UV rays are very high, that may not be a safe option if you are fair-skinned and the sun is powerful. Sunburn is not a great way to get that vitamin D in. So that is always a tricky one. If you live in northern climates, certainly in the winter, getting your skin exposed to 20 to 60 minutes of sunlight every day may be highly uncomfortable. There are some foods that are high in vitamin D, egg yolks and fatty fish like salmon, mackerel, sardines. And of course, perhaps the most convenient way, and certainly an easier way, especially for people with autoimmune disease who need higher amounts of vitamin D supplementation, there is always vitamin D drops. Vitamin D comes in tablets and it comes in drops. An important thing to remember here is that vitamin D is fat soluble, meaning it's best taken in drops as it is suspended in an oil, which makes it easier to digest and get into your body. I learned this the hard way when I was taking vitamin D tablets last winter, and I changed what I was taking them with, and apparently the new food source I was eating them with was not containing enough fat for the tablets to completely dissolve. And it actually ended up in me in the emergency room getting a CAT scan, and they came back and told me that I had these white rocks in my bowels. The problem was my vitamin D tablets were not digesting, and having Crohn's disease and having had a bowel resection, I actually have a narrowing in my bowel, and those little tablets went down there and they basically created a blockage, and I had a temporary bowel obstruction. So I spent the better part of a week in hospital on bed rest, waiting for that to pass. So the short of it is, I always now take my vitamin D in drops in the suspended oil form. And ideally, for people with autoimmune disease, it's recommended that you get 5,000 to 10,000 IU a day. So if you're taking that in drops, that's 5 to 10 drops a day. You can just put it on your tongue, you can put it in your food, in a drink. It really doesn't have a strong taste to it. I just put it right on my tongue and don't even notice. And ultimately, if you do start taking vitamin D, you do want to consult your physician and ideally get some blood work done. Get some done before you start so you know where your vitamin D levels are at. And then begin taking your vitamin D regularly, 5 to 10,000 IU a day, depending on how low your levels are. Your physician is always a great person to consult for that. And then 6 months down the road, get it tested again, and you'll be able to see how resistant you are. Are you absorbing enough vitamin D from that dose, or do you need to increase that dose higher? There are doctors that work with patients with MS who have had them on as high as 50,000 IU, 35 to 50,000 IU daily. Now they work very closely with the doctor. They do regular blood work to monitor that. You don't want to take too much of vitamin D because just like anything else, too much of anything is not a good idea. So that's all for today. I hope you found this informative, and hopefully it will give you reason to start taking some vitamin D today to improve your immune health. And until next time, stay healthy.